Okay, let's get the show on the road. I'll do a little bit of an introduction and then we'll get right into it. Again, thank you so much for taking time today to watch this webinar on laser therapy, or really it's called photobiomodulation therapy for long COVID symptoms. My name is Dr. David Kunashko. I'm the medical director at BioFlex Laser Therapy. We are a medical device company, been around for over 30 years, 3 decades of using the equipment by healthcare professionals and consumers alike for all sorts of different issues. So today's webinar, as I mentioned earlier, is that it's on long COVID. And those of you who aren't aware, these webinars are always recorded. Eventually, usually within a week, they're uploaded to our support page on our main site, bioflexlaser.com. And we're trying our best that when you register, we send out a follow-up email a week later with a link to watch it again. Or if you can't, actually, if you register and you can't watch it that day, you should be getting an email, but hopefully you do. If not, you can just go to the website and watch it there. Okay. And what else? If you have any questions, type them into the Q&A box, not the chat box. Feel free to chat amongst yourselves. Let everyone know where you're from. Any comments, that kind of stuff would be great. Remember, if you have something for me, type it into the Q&A box. I did notice that Rose sent me something, but I prefer, if you don't mind sending that in. I'll take a look at the chat box, but I prefer in the Q&A box. Alrighty, so I'm going to talk about long COVID today, about COVID as well, the initial infection, but more so around the chronic sequelae in some people of COVID, and referred to as long COVID, but there's other names for it as well. I'll talk a little bit about photobiomodulation therapy, obviously, or laser therapy, why it might be useful in treating these patients, some of the research that's been published. Remember, this is all pretty new, so there's still not a lot of research, but it's coming out and it's quite interesting. And then I'll talk about how you might approach some of these symptoms using our equipment. And I do have a guest speaker, a registered massage therapist, David Barker, out of Kingston. And he messaged me not too long ago and saying, hey, I had some good results with a client, a patient. And I said, oh, great. Why don't you come on and share that experience so we can find out a little bit more your approach and what happened and so forth. So we'll bring in David towards the end of the webinar, and then I will have time for Q&A. We'll go a little bit over time, hope to finish around 1 o'clock as opposed to 12:45. All right, so I won't go into detail on COVID. I think we're all kind of aware of the virus that it is. It triggers an infection, typically the host cell or epithelial cells, so the cells that line things like your alveoli and blood vessels and those kinds of things. And what happens is this viral infection obviously would trigger an immune response, and typically it causes mild to moderate symptoms, your fever, your cough, myalgia, dyspnea, and sometimes even pneumonia. However, it can lead to immunopathology due to excessive inflammation. And what we've all heard about is a cytokine storm. And this can lead to severe and even critical symptoms. Obviously, we know this, and people can succumb to that, especially if they have poor immune systems and multi-organ damage and so forth. I think everyone's pretty well aware of that at this point. But the point I wanted to make about COVID is the impact of mitochondria. So essentially what happens is the viral RNA of the SARS-CoV-2, it essentially takes over and manipulates the mitochondria, and it hijacks them. And that's where the cellular machinery is made. So it ends up with dysfunctional mitochondria. They get fragmented. They start to all sorts of weird things start going on with the response of the immune system. It leads to inflammation as well. That's one of the hallmarks of the disease. So those of you who know a little bit about photobiomodulation already know that one of its main ways it works is on mitochondria. So it makes kind of sense that if you can improve mitochondrial health, that the cells that are affected by COVID might have a better chance at survival. And really that's kind of one of the main kind of centerpieces of hypotheses of why photobiomodulation therapy might be helpful. This is a quote from a paper that was published recently in Nature. Nature is one of the top science medical journals out there. And the quote was that long COVID is an often debilitating illness. The numbers are approximately 10% of those infected with COVID. And I'll talk a little bit more about those numbers. And the point that they try and make is that there's currently no validated effective treatments for COVID, for long COVID. And so this is the problem, right? I mean, what do you do with these people, these patients that are affected? And it's so new that, you know, they're still trying to figure things out. And photobiomodulation might in fact be it's definitely safe with no side effects, but it may also be an effective way of treating these patients as well. Lots of different hypotheses and reasons for why long COVID might be established. You know, I'll go over these a little bit more detail, everything from the reactivation of the virus to autoimmunity issues, to dysmetabolism that has to do with the mitochondria dysfunction, persistent pockets or reservoirs of COVID that never quite healed up. That's almost when you think about things like chickenpox, right? Where we have the virus latent in nerves and it could cause shingles later on in life. Not necessarily that same mechanism, but perhaps it being latent. And persistent inflammatory issues and causing immune dysregulation. These are all potentials. This is the paper I mentioned earlier. I did have the link to it. If you just search this on Nature, you'll find it's a free download. And so really the next several slides are going to be talking and referencing this paper specifically all about long COVID. So this is really the most up-to-date information that I could find on long COVID. So as I mentioned, it can be very debilitating. They figure that it's at least 10% of people that will go on to get long COVID. And so far, they've identified well over 200 symptoms that have been of multiple organ systems affected. Right now, just by that sheer estimate, that over 650 million people have been infected by COVID, that roughly 10% or 65 million are walking around with long COVID. So it's probably a lot more than that. So roughly 1 in 13 adults may get long COVID. And so there was a recent global survey, and in this, it suggested that long COVID is composed of a heterogeneous sequelae that often affect multiple organ systems. This is kind of the definition they're using, but it's not the specific one. It's not the accepted one. There is none yet. Beyond 4 weeks. So if your symptoms are going on past 4 weeks of the onset of symptoms, that's when you can say, hey, I think I have long COVID. And it can have obviously significant impacts on one's function and quality of life. A lot of people aren't able to go back to work or have all their activities of daily living really affected by this condition. So incidence-wise, I think I've mentioned 10%, 30%, that kind of scenario. Those are in non-hospitalized cases. In hospitalized cases, it's much higher, 50 to 70%. And if you get COVID and you're vaccinated, it's much lower at 10 to 12%. So, get your vaccinations up to date. Hopefully you're not an anti-vaxxer, but anyway, long COVID is associated with all ages, so children can get it as well, and even into the acute phase disease severities. Sorry, I won't get political about vaccinations, I promise. With the highest percentage of those getting long COVID are between 36 and 50, and that's because that's a subset of age group that gets most infected by COVID, right? So as I mentioned, it does seem to affect all sorts of different areas of the body, and this can include cardiovascular. It can cause cerebrovascular disease and strokes. It can affect the pancreas and cause type 2 diabetes, chronic fatigue syndrome, myalgic encephalomyelitis, dysautonomic autonomia, which is dysfunction of the autonomic nervous system. And funny enough, we've been seeing patients coming in with POTS, postural orthostatic tachycardia syndrome. I think it's a sequela of long COVID. Well, it is, but I think we're seeing these people because of long COVID. So we were thinking about doing some case studies with these people. Unfortunately, the symptoms, and by the way, I'll get to your questions at the end. They seem to last for a long time. They can last for years. And there's thinking now that some of the symptoms might be lifelong, especially ones related to chronic fatigue syndrome and this myalgic encephalomyelitis. And as I mentioned, well, it's affecting the labor force, and a lot of people are struggling with work as well. And this paper goes on, as I mentioned earlier, that unfortunately, there are no validated effective treatments currently. So it affects potentially the heart. You can have chest pain, palpitations, cardiac impairment, POTS, myocardial inflammation. It can affect the lungs, obviously, chronic cough, dyspnea, the pancreas, as I mentioned earlier, and diabetes, the immune system, can cause autoimmunity issues, GI issues, ongoing abdominal pain, nausea, persistence of the virus, gut issues or dysbiosis, which is upsetting of the normal biome of the gut. All sorts of neurological issues, brain fog and disordered sleep. I mentioned fatigue, cognitive impairment, memory issues. I mean, it can really be affect lots of different systems. The kidneys can be affected. We certainly know that blood vessels can be affected because of the endothelial cells, even in cases of strokes and microclots, deep vein thrombosis. So we're starting to see, doctors are starting to see a lot of these things, and they're now relating it to COVID, post-COVID, long COVID. And then the reproductive system as well, everything from erectile dysfunction because it affected the small capillaries to increased severity and number of premenstrual symptoms, irregular menstruation, reduced sperm count. So you can see it affects the body as a whole because of endothelial cells are everywhere. So there are probably multiple reasons why this is occurring. Very sort of generally speaking, I mentioned it might be persistent reservoirs, it might be immune dysregulation, there might be reactivation of pathogens in your body already, like Epstein-Barr virus or certain herpes viruses, that kind of thing. As I mentioned, it might affect the microbiome or the microvirome of your body. These are, normal pathogens. Well, not pathogens, but normal bacteria and viruses that are in symbiosis with your body, but they get thrown out of whack because of the infection. Autoimmunity issues, something called molecular mimicry. It's nuts, and I say that because people are coming in, they're like, I don't know what's going on or whatever, and sometimes you might have a subclinical case of COVID and not even know you had COVID or whatever, or just you didn't even think much about it because you had a mild case of COVID. But you can get these issues, microvascular blood clotting and dysfunctional signaling in the brainstem. I heard of tinnitus as well, ringing in the ears, vagus nerve being affected. So all of these different things, these are just kind of visuals of what I just described earlier of what potentially can be going on in these patients. So if you are a clinician listening in, this might be something that when you're doing a history on your patients is that you talk about the potential for long COVID, especially if you're not quite sure what's going on there. And you may also want to educate your patient base about photobiomodulation, perhaps helping these symptoms. Again, I'll talk about this because it's not black and white as far as its effectiveness yet, because we don't really have a lot of clinical trials. A little bit, I'll share those with you, but we're still learning. So don't overpromise is what I'm trying to say. And it can affect children. They found children with long COVID are oftentimes fatigued and have headaches and dizziness, chest pain, poor appetite, difficulties concentrating, memory issues, mental exhaustion, physical exhaustion, sleep issues. And these are especially in teenagers as well. So in this paper, the authors conclude that now, with over 2 years of research on long COVID and decades of research on other conditions like chronic fatigue and the myoencephalitis, that a significant proportion of individuals with long COVID unfortunately may have lifelong disabilities if they're not diagnosed and treated, and that's the key. So unfortunately, the authors point out that the current diagnostic and treatment options are extremely insufficient. There needs to be more clinical trials. They need to be rigorously tested, obviously. And today, what I'm going to present are not rigorously tested, randomized control trials yet. A little bit, but so we still don't know. But we're seeing promising results. So, I mean, if you have something that in your toolbox that you may be able to use, then, and there's no side effects, then definitely I think that's worth a try, as opposed to trying something that has unproven and side effects like medications or what have you, right? Of course, if it's something serious, they need to see their physician. So let's talk a little bit about photobiomodulation therapy, laser therapy. I think everyone here, if you've been watching or a student of photobiomodulation therapy, or you're well aware that the light and certain wavelengths of light affect the mitochondria, and this has to do with absorption by photoacceptors and in the electron transport chain. And you can see here the cytochrome C oxidase is the key one, and there are some key things that happen when you affect the mitochondria and the cytochrome C oxidase. And these are in cells that are impaired, right? Not normal, happy-go-lucky cells. These are in cells that are affected by an infection or inflammation or some kind of metabolic stress. They're not doing well, not normal, healthy cells. In those scenarios, ATP production is lowered. So what happens is photobiomodulation can increase ATP, not above the normal levels, but bring it to normal levels. And therefore, it increases the cell's ability to fight infection and accelerate the healing process. That's the key here. It can also modulate something called ROS, or reactive oxygen species. These are free radicals, oxygen ions with triplet electrons, different numbers of electrons. And in high concentrations, they can be lethal, but in lower concentrations, they can be stimulatory. So the body uses these to, and they're released when you make ATP to trigger things to go on in the cell. That's a good thing. You just don't want them too high. If they're too high, then the free radicals can cause damage. So these ROS can positively impact cellular repair and healing as well through different mechanisms I won't go into right now. And one of the sort of byproducts of these reactions is a release of nitric oxide, which in higher concentrations is binding to cytochrome C oxidase and impairing ATP production. And when the light dissociates nitric oxide from cytochrome C oxidase, it freely diffuses out into the bloodstream or extracellularly, especially if they're in endothelial cells, which are lining blood vessels. And this can cause vasodilation, increase microcirculation. It can help decrease inflammation and help improve transport of oxygen and immune cells throughout the tissue. So you can see where this would have great benefit to do. And I'm going to say right now that if you use laser therapy or photobiomodulation very quickly, like very short treatment times, you're not going to have the desired effect that you want to treat these kinds of things, because you need ongoing light stimulation on cells to trigger a good response. So it's not something you want to just blast with a huge amount of light in a short period of time and get on to your next patient. It's not going to be effective. At least it won't be as effective. So remember that photobiomodulation has two types of effects. One is directly on a cell. So an impaired cell absorbs the light and it can help restore or repair or improve mitochondrial function. That's what this diagram is kind of showing. but it can also be absorbed by circulating immune cells and platelets and stem cells. And these all have a role to play in, as you can imagine, in long COVID and COVID as well. And so this is part of the issue. This was a guest editorial. By the way, David, if you're listening in, I know you are, be a little bit later than 12:40. I'm taking my time with this, it appears. So this is a little editorial on the potential role of photobiomodulation long COVID. And really what they're saying here is that it seems to make sense that long COVID and the symptoms of it, which are metabolic, immune system affected and inflammatory affected, and there's pain and so forth, photobiomodulation can help these types of symptoms. So it makes sense. This paper was published on treating headaches, tension type headaches or cephalia, which is, I don't know why they use that term, and oral facial pain in post-COVID patients or long patients. It was a randomized parallel single-blinded clinical trial. They used near infrared and red light. They used 100 milliwatts, 6 joules per point, 8 points, 2 sessions per week. They used 8 points around the neck or tender points around the TMJ. So just like treating trigger points or tender points with a laser probe, a kind of scenario. So it's pretty easy to mimic if you wanted to do this type of treatment. Whoops, back up. And what they found that these points were quite helpful. And that I can't believe I didn't put the conclusion on this, but essentially what they found was that the laser treated compared to the placebo had improvement of the duration, frequency, and intensity of the headaches in these post-COVID patients. Sorry about that. I meant to put in that conclusion, but that's what they concluded. This next paper was about loss of taste sensation that we've all heard about in COVID. And I think I didn't read a lot about it, but I'm pretty sure it has to do with the fact that, you know, when you breathe in the virus, it can affect the olfactory nerves, and then it creates all sorts of havoc. So this particular paper looked at 36 patients who were complaining of persistent loss of taste sensation. So this can be a long COVID kind of scenario. They had group 1, group 2. Group 1 was a laser, group 2 was the placebo. And then they subjectively, because there's really no way of objectively sensing for taste, but they must have had different samples that they, you know, checked for bitterness and sweetness and all that kind of stuff after 4 weeks. Now, they used 940 nanometers. I don't know, it's kind of an odd wavelength. And it's not odd, but it's not the one that's traditionally used. But you can still get an effect in the 900 up to 1,000 probably as well. And they used 1 watt. So this is a higher powered laser, but it was spread out over a larger surface area. So it wasn't burning, obviously, the tongue. So basically they stuck out their tongue. I won't do it. And then they would kind of, you know, treat around the tongue with this laser. They did a total of 6 minutes treatment time. And the thing with this is that it's impossible to know the dosage because it's reflecting off the tongue. I don't like this way they did it, and I'll talk about how you might be able to do it with our equipment. And to me, it makes more sense. But long story short, the results demonstrated a significant difference between both groups regarding taste restoration after 1 month, with group 2 having a significantly higher percentage of cases, 38.9% with partial taste restoration. So those were the placebo ones. But in the group 1, which was the laser treated ones, over 90% had complete taste restoration after a month. So clearly it did something. This paper actually this research trial looked more at COVID, but remember, post-COVID, long COVID, you can still have lung issues, coughing and dyspnea and all sorts of issues. So that's why I'm kind of presenting it here. They looked at 30 patients who were undergoing, that had COVID, so acute COVID. And then they were treating them, you know, with whatever they were treating with. And some of the groups received near infrared, 940 nanometers again, LEDs though, and they were all receiving, typical standard treatment as well. And then some got a placebo LED. And so they used 300 LEDs. This is a surface area over the lung fields. I don't know whether they did the abdominal regions. Doesn't make a lot of sense to me. But anyway, total power is 6 watts. That's the LEDs. That's a cumulative power. They did it for a long time, 15 minutes irradiation time, because the power is pretty low. This is kind of what it looked like. So if you've seen our equipment, you know that these diodes that we have would be pretty similar to that. This is but it's a much larger pad. But you look at the spacing, the diodes are spaced pretty far apart. But they did that. So the 6 watts, not a lot of power, by the way. And the power density would have been pretty low. They didn't say what that was. I could have calculated, I guess, but it would have been pretty low. That's why they treated for a fairly lengthy period of time. So they looked at the cardiopulmonary functions and the blood count before and after treatment, and the patients were treated daily for 7 days with this device. And the results here were that the post-treatment LED group showed a reduction in hospital discharge time and a statistically significant improvement for partial oxygen saturation, tidal volume, maximum inspiratory volume, expiratory pressures, respiratory frequency, heart rate, and systolic blood pressure. And it was observed in the post-treatment that the LED group presented with significant differences in counts of white blood cells as well. So improvement of the white blood cell count. So they concluded that photobiomodulation therapy might be able to use as a complement to conventional treatment to help improve cardiopulmonary function and minimizing the respiratory symptoms. This would make sense too for pneumonia and for other respiratory conditions as well, by the way. So photobiomodulation using BioFlex. Well, there are no approved protocols. I'm going to say this right off the hop for long COVID or COVID. This is considered off-label use. It's at the discretion of the practitioner. So just understand that. The approach to treating headaches, as the paper I mentioned earlier, well, we already treat headaches. We have a headache protocol. I would suggest using that and using the laser probe for treating the trigger points as well. So I think that could be effective. So I don't need to spend a lot of time on that, because if you're not familiar with treating headaches, I have a webinar on that as well. So it'd be a similar approach, and it makes a lot of sense that it should be helpful as well. Now, if you're treating an acute lung infection, we talked about this paper and treating a lung infection, then you can apply the arrays over the lung fields and the anterior and the posterior lung fields. Or if it was a persistent cough or ongoing long COVID issues affecting the chest wall, then similarly you could do this. I'd suggest just using near infrared because I don't think red's going to do a whole lot in this case. You got the chest wall. Certainly red's not going to go anywhere. Well, it may be helpful for some of the localized blood circulation. You're really trying to want to get near infrared, as deep as possible and in and around the lung field. So I might suggest you use the Duo Plus in the near infrared mode and set it to continuous wave. So as far as the time goes, well, then, you can go up to, I meant to say 6 to 8 minutes, not 1 to 8, by the way. So that should say 6 to 8 minutes. You can set it for 6 to 8 minutes. You maybe start with 6 and work your way up if you'd like, and treat the lung fields. So depending on the size of your patient, you might need, I don't know, like 4, 6, 7, 8, 9, 10. It all depends. And if you have a dual port or whatever you have, if you can only do certain areas, then just do certain areas. But I think that would be effective. Loss of taste sensations, a little bit more challenging. So the idea here is that you want to treat the tongue. Now, so you're not going to use the array for this, obviously. You're not going to shove an array around the face or into the mouth or whatever, obviously. But you could use a laser probe. Now, it's not designed for intraoral work. I would suggest that you, as a hygienic barrier, use a transparent plastic wrap over the tip of the probe. You can engage the tip of the probe with your finger, and when the patient sticks their tongue out, you could hold the laser probe to the tongue. It's safe. Remember to wear the eye protection, right? And you'd want to hold it directly to the surface of the tongue, as many spots as you can get. You don't want to trigger a gag reflex or anything, and you may have to do it in stages because it might be hard for a person to stick their tongue out for long periods of time. And I suggest starting off with 50% power, maybe 8-10 seconds per point, and try and treat as much of the tongue as you can, especially on the surface of the tongue. That's where the taste receptors are. As well. So I think that might be helpful as well. So I suggest treating daily. And then, as I mentioned, you can kind of adjust things depending on the subjective feedback that the patient gives you with respect to taste sensation. There's obviously lots of other symptoms of long COVID, over 200. So we have lots of protocols. We have certainly clinical support here. If you have any questions, unique cases or what have you'd like to discuss, we're certainly here to help you as well. But you want to just try and target the tissues affected, right? If it's superficial, like if there's a neuropathy going on, then try and affect the superficial blood vessels and nerves, in that area. So you can adjust red light, you can adjust near infrared light, that kind of thing as well too. And before I get to David, I'm going to bring David in 1 second here. I just want everyone to be aware that we do have new consumer devices on bioflexwave.com, and that's where we also sell our personal systems as well. And some of these might be also helpful for treatment at home of some of these long COVID symptoms as well, especially the personal system, maybe even the nano. You could use the panels as well to some degree. I'm not they're very helpful, but if you want to get light into the lung field, I prefer to touch the tissue to get light in there. But if you don't have that capability or whatever, then these would also give benefit to these patients as well. Okay, I'll ask David to chime in now. David Barker is a registered massage therapist. Let me just see here, make sure that I'm going to see if he's can do this. There we go. Hello, David.
Hello, how are we?
I'm good, thanks. Thanks for joining me today. So as I mentioned, David is a RMT out of Kingston, Ontario, and we keep in close contact a lot. He's spoken at some of our events, treats lots of interesting cases. And this just goes to show you that these patients with long COVID are showing up to every clinician, whether you're an RMT or a DC or a PT or a naturopath or whatever. So that's why I want to bring David on and to chat a little bit about a recent client of his that had long COVID. So I'll let David kind of explain the scenario.
Yeah, okay. So a patient came to me with something I found very interesting. This was in April of 2022. And I had not treated any type of long COVID symptom picture at all. So, and if you've heard me speak before, I often tell everybody, if you're using the system, always use the knowledge base at the clinic in Toronto. They're there for you. So I had not treated any COVID symptoms, period. And so I sent an email to David, and he answered me back quickly. And I said, this is the way I would approach this. And do you have any insight as to what to do? And he added, so I was using basically, as you saw earlier here, the headache protocol, just a little bit of modification that I've learned from David and Dr. Ewing in Halifax. And but David said, why not add using the probe into the nasal canal to affect the blood vessels and the nerves, which I had not thought of. So that was something that would help quite a bit along this line here. So I'll tell you a little bit about the patient. She's a teacher in one of the school districts here, and there was a huge group of teachers, 15 total, that all went out with COVID at the same time. They all had similar symptoms, and they obviously all caught the virus from the same source. and they were all sick for the same amount of time. So 3 months later, the large portion of them were still experiencing long COVID effects. Okay. So she came to me saying, would your laser have any effect on this? So we said, let's try it. Okay. And she begged and pleaded me. She said, I don't care. The fatigue is crushing, all the other symptoms, but I'm a foodie. Okay. And either kill me or give me my taste and my smell back, which I thought was really interesting. So I said, let's give it a whirl. The neat thing we had here was we had an unofficial anecdotal control group to work with, because we're going to treat one of the affected persons, and we have 14 other people to refer to. And I'm getting the information through the teacher I'm treating, but we can compare symptomatic pictures as we go. So I won't get into protocols. I'm sure most of you are using the laser already, but we are using a little bit of a modification of the headache protocol. I use the red and the infrared probe. I find it very beneficial to use both. And like David said, my treatment lasts a good 40 to 45 minutes. It's not a quick treatment. Okay, so what we did in the first session was do very low dosing just to see what kind of effect we had there. And I did engage with the laser probes, the cranial nerves, especially when we're looking at 7, 8, and 9. So and 10 actually. So the vagus nerve definitely part of my thought process and what we know about gut-brain health. Okay, so after the first treatment, and I don't know if David's had similar outcomes, but it was incredibly profound what happened when she came in for her second treatment. Her fatigue had definitely decreased, but literally her sense of smell was almost back to normal. We're going to say probably in the range of 75 to 80% back. Okay. I had her check with her control group before she came. I thought this was so wild that this could happen in treatment 1 that I had her check that maybe everybody's just getting all better at the same time. And she reported back there was absolutely no change to the other 14 teachers. Okay. On the second treatment, I brought the dosing up just a little bit. Okay. Went through the same treatment process and using red and infrared laser in the nasal passage. I did not, at that point, think of treating the tongue directly. And listening to David's talk today, I would definitely do that in the future. But we use the arrays on the jawline and use the probes through the cheek. So we are getting some effect on the tongue, obviously. So treatment 2 is when the energy changed in the client and also in the patient. And we found that not only her energy, her smell even came up, her sense of smell came up to about 96% back, and she was getting a widening of taste, which made her very happy. But she explained her amount of energy by saying her classroom on the second floor, there's a landing in between. She said before the first treatment, she'd have to stop once on the staircase, once on the landing, and once up to the next floor just to make it to the second floor. Okay. So now she's saying, I only stopped once on the landing and could make it up the rest of the way. So, and this all happened very quick. We were treating every day. So by treatment 3 and treatment 4, she had advanced to the point where smell was completely back 100%. Taste was at 90. And this is after treatment 4. And she could walk the flight of stairs without any fatigue whatsoever. I thought that was amazing in itself, because we'd only done 3 to 4 treatments at this point. We're having this amount of effect on something that's been 3 months chronic. Okay. And then after the last treatment, her taste was 98% back. And she told me, jumping up and down when she came in for the last treatment, that she can run the staircases now. So, so I thought that was just an amazing 5-day, basically, intro to me to what we can affect with an inflammatory condition that's caused by a virus that, of course, David has explained eloquently prior to my talk here. And if anybody's interested in what numbers I used in my protocols, you can always contact me. David can give the website out maybe, or David at David Barker Clinic. Oh, I see. I'm up there right there. Okay.
Yeah. So David, then that was every day. So this was about a week of treatment then, right? Okay.
Yes.
I mean, it's interesting that she responded so quickly, and I'm sure you're aware that some patients seem to respond really quickly to photobiomodulation, others a little bit slower.
I would have loved to have more people from the non-treated group to compare those, the treatment times or the number of treatments needed, and even dosing changes that may have been, but I didn't have that ability. But I see this person ongoing for massage therapy also, and 3 months after our sessions for the long COVID, she still was absolutely healthy. She was telling me, and this is 6 months after the initial infection, and then 3 months I did the long COVID treatments. So 6 months in, we now have still a large group of those 14 other teachers that were symptomatic, or some of them even on modified duties, and not back to normal.
Too bad they didn't get referred into you. That's unfortunate.
And it's an interesting thing. COVID is a different animal, right? People have a lot of opinions about it, and we won't get into the politics of it, but it wasn't from my patient not trying to get the other people in, but
yeah, for sure. A few questions for you here. One was, as far as the time span between treatments, and so you did it daily then, I guess, right?
Yeah. So I did. And this was on the patient's request, along with my my knowledge of treating for better outcomes. Many times I'm every other day, but there are times when I've been working, say, on a fracture, and we do twice a day. And I learned that from Dr. Kahn way back when, well, I don't know if you remember when he treated Antonio Davis from the Raptors, but he said they were treating first and last appointment of the day, and got best results with, as long as there's hours in between for that biochemical response to happen within the tissue.
Yeah. That's true. That's a good point, is that normally we say, and usually see in these trials and everything, it's once a day or every other day or whatever. But in acute scenarios, you know, and if you space it out enough, then I think re-stimulating in that same day can be extremely helpful. You just don't want to treat very quickly between treatments. So not in an hour.
No, you can actually negate the benefits of the initial treatment if you don't give it time.
Sure. And then there was a question here about, was all your treatment in and around the head area? Did you treat anywhere else?
Yes, mostly around the head. I did treat a little bit around the area of C1, C2, just to activate the area without getting into a lot of detail, but I could send pictures if anybody wants to email me, where we can actually get a good shot at activating the vagus nerve. in the neck area, and that's going to have a systemic effect.
Right. Awesome. A couple other I'll just keep you on here, David.
Yeah.
Someone's asking about
No
pictures.
problem. I'm a student of these webinars, by the way. I get as many as I can in because I've been using the laser 8 or 9 years now, but every time I listen to David's webinars, I pick up another nugget or oh, if I tried that, maybe I'd had a better outcome. You know, you have to keep reanalyzing how you treat.
Yeah. Now, if you're interested in photos or a bit more information from David, again, you can just reach out to him. Your email again, David?
David@davidbarkerclinic.com.
Right. Or you can just Google his clinic as well. It's pretty easy to do that. There's a question here about brain fog with long COVID and recommended treating every day, every other day. You know, when we treat this is us, when we treat neurological conditions like that, usually we start every other day. And we sometimes just do the array and see how they are, because if they're light sensitive or what have you, and then, you know, that kind of scenario, sometimes with chronic conditions, being too aggressive may not be a great thing. But again, it's always trial and error kind of thing. You know, this brain fog, you know, it's affecting the neurons in the brain. So and nerves heal very differently than other types of cells. So they tend to take longer, and obviously it's more challenging getting light in or near the affected areas. So for us anyhow, we start pretty conservatively as far as treatment goes.
As do I. I learn just the effects we can have on brain fog by treating motor vehicle accidents and treating the spinal area where majority of the whiplash occurs. And patients, just by me treating the back of the head and the suboccipital region, patients respond back or report back less brain fog.
Yeah, for sure. Okay, so we're going to wrap up. Just one last question here from George, just talking a bit about issues around anxiety, depression, and long COVID, and well, that wasn't addressed specifically. I think this kind of makes sense with any chronic condition comes depression and probably anxiety too. So I think that's all part of the big picture as well too. Listen, David, I really appreciate you joining me today, and everyone for listening in. Again, if you have any questions, feel free to email us. I will be doing a webinar on shingles coming up in October. I'll be out at the BCCA, the British Chiropractic Association Annual Conference in October 21st and 22nd. So if you're in the area, drop by and say hello. I'll be in Los Angeles coming up in November. So if you want details, just go to our website for that. And again, you can reach me at david@bioflexlaser.com or David Barker at davidbarkerclinic.com.
.com. Yeah.
Great. Thanks a lot, everyone.
Thank you much.
Bye.